I was really compelled to visit the health projects in Kenya for a number of reasons. AIDA, being present in this sector, in this country, since the 1960s, has been a very trusted, strong partner for the Kenyans, and I wanted to see that work happening in front of my eyes.
If there is one sector in which there are no borders and there is no possibility to move forward if you don't do it collectively, is health. Aki told me, you have to come see what France is doing with AIDA. AIDA's concessional funds are used in a variety of projects and programs. The idea is really to ensure that no one is left behind and to be able to save lives. Through Gavi, the Vaccine Alliance, that's another example of how we've pushed for immunization equity, and France's contribution has enabled the vaccination of millions here in Africa, fortifying against preventable diseases and having the way to pandemic preparedness.
AIDA has been able to help these medical facilities at a time of crisis. And what I mean by this is in this newborn ward, we saw the oxygen supply facilities. Now that was a critical function during the COVID years that AIDA helped install in these facilities.
Since I came here, my baby was still tiny, and you can see by now it's a bit big. I've enjoyed to be here because my baby has been well maintained and has been well kept.
France has proudly been a long-term partner of AIDA, and being here and visiting a facility and seeing a project that is still on its way, it's extremely important because it shows how health is a global matter. Pandemics, viruses, diseases do not have borders. They are global by definition, and they can only be treated if we do so in a coordinated way.
Being here today really showcases the shared responsibility around global health. And Kenya has always been at the forefront of this partnership globally to work with other countries and to make investments in healthcare, make the real impact for the people. And working with the World Bank and AIDA, and now working with France through the World Bank, we are keen to leverage on the investment the Kenyan government has already put, not just for Kenya, but for the entire continent.
Il y a maintenant plus que 60 donateurs solidaires et la France est un des plus grands. Et sans la France, ce serait impossible de faire tous les travaux qu'on fait à Kenya et ailleurs.
We need to work together when it comes to health. You know, we're presiding the G7 this year and working on a very ambitious reform of the architecture for financing of development, because we understand that if we don't do this, if we don't reform the way we are financing development today, we're not going to ensure that the priorities such as health are treated the way they should.